is Mark Morris, and you're watching and listening to Along the Rock, our podcast. My guest today is Cory Law from the Whiteside County Health Department. Cory, thanks for stopping up.
We're happy to be here.
And a true health-conscious health department worker, you're wearing a mask, which I'm guessing we all, could be wearing, but I'm sure a lot of people got tired of it once the chances of getting COVID were at least reduced.
Absolutely, and I'll tell you, I did stop wearing my mask for a while, but in this season we're seeing more flu, we're seeing more COVID, we're seeing, just respiratory gunk and stuff in general, so I wear my mask to try to keep myself and those around me healthy.
All right, good idea. Well, tell me, vaccines are not a modern invention, I guess, in terms of all history they are, but vaccines have been around this country for many, many years.
Yeah, absolutely. There are a lot of vaccines out there, and it can be confusing exactly what you need, when, who qualifies for what, because there are ages, age requirements, things like that. So the thing I like to start with when talking about vaccines is that just to remind everyone that vaccines are one of the most successful and successful and cost-effective public health interventions to ever exist. Not only is someone who's immunized less likely to get ill, they're less likely to be an asymptomatic carrier. So that's someone that can spread an illness without showing signs and symptoms. And the more people who are immunized just reduces not only immunized people's, but unimmunized individuals' chance of being exposed to a illness. So it provides what's called herd immunity. So that's where a high percentage of the population is protected through immunization. It protects even those who don't get immunized, but you need a very high percentage of people to be vaccinated to receive that. So just to kind of look at vaccines and where we were prior to it, or prior to some of the more common ones, smallpox back in 1920, the U.S. saw about 110,000 cases of smallpox each year. By 1949, smallpox had been eliminated in the U.S. Thanks to vaccination, and by 1980, smallpox had been eliminated worldwide. That's one of the greatest successes of vaccination.
Yeah.
But in addition to that, measles, around 1912, there were about 6,000 people who died each year from measles, and then before the vaccine came out in 1963, there were about 4,000 people who became ill with measles, 3,000 to 4,000 people who became ill with measles each year, and we saw 400 to 500 deaths, up to around 48,000 hospitalizations, and 1,000 people who might have suffered from encephalitis or brain swelling, which can cause long-term neurological consequences. So even though maybe not as many deaths in 1960 or 1963 from measles as in previous years, still a lot of disease burden, hospitalization, things like that. And now, since 2000, measles has pretty much been considered eliminated in the U.S. So those are just some numbers that kind of help show not only does vaccination reduce illness, it has a substantial impact on hospitalizations and death.
Right. So that's a demonstration of how successful they are. Just a small note here. I think when some people, when they hear the term herd immunity, they think, I don't want to be part of the herd.
It does have maybe a little bit of an unfortunate name to it, but it's really an amazing protective factor that just exists. We are exposed to each other. Every interaction exposes us to different people throughout our day. People at work, people at the store, things like that. And especially when we look at measles, measles is very, very infectious. If you have 10 people in a room who are not immunized against measles, and you have someone with measles in that room or who was in that room prior, 9 out of 10 of them, just from that exposure, are probably going to contract measles. So, it's just the herd immunity thing is just one of those protective factors that, again, the more of us who are protected through vaccination, it protects us from, vaccine breakthrough exists. You can get a vaccine and still get ill, but again, more people who are vaccinated mean potentially less exposure to that, which, reduces the chance for vaccine breakthrough, for just exposure in general.
Is that what you tell people when they ask about it? Because as we've mentioned, there are a certain number of people, a certain percentage of the population that somehow thinks that vaccines are a conspiracy of some sort in the worst case scenario, and just something they don't want to expose their kids to as another reason.
Yeah, absolutely. And, it can be hard because, some vaccines are more effective than others. Again, when we look at vaccination, it's one of the things that there's one thing you can do to prevent illness, and it's get vaccinated. When we look at measles, polio, pertussis, those are very successful vaccines. What else in our life, health-related, is there one single thing you can do to prevent an illness? If we look at preventing heart disease, exercise is very important, but smoking can contribute to heart disease. Your diet can contribute to it. It's very hard to avoid heart disease, as we get older, there's more stress, things like that. But vaccines are one of those things that there's just one thing you can do to prevent it. So again, it's very simple. And then the other thing when talking to people is just, providing education, reminding people that even though we don't see the serious outcomes from some of these vaccine-preventable illnesses anymore, they do exist, and the reason we don't see them is because people aren't getting sick with them anymore, like measles, polio, things like that. Mm-hmm. So it's just trying to provide that education, and again, looking at the data that's been collected by CDC and other agencies throughout the years, vaccines are very tested and one of the most studied interventions.
Oh, absolutely. Are you ready to move into COVID and its numerous variations and variants?
Absolutely. So again, when we're talking about vaccines that aren't as successful all the time as measles and polio and things like that, we're looking at flu and COVID. And the reason for that is there are so many strains of both flu, COVID, and they mutate so readily. And when a virus mutates, what can happen is it can evade natural immunity, it can evade vaccine-acquired immunity. So it changes enough that your body doesn't recognize it. It doesn't look like how it previously encountered it, or the vaccine that you might have gotten. So that's why flu and COVID are seasonal vaccines, because again, those viruses change enough, and there are so many different varieties out there that the one circulating this year probably isn't going to be the one circulating next year. So that's why we look at that. So again, that's why those are seasonal. So when looking at COVID specifically, in 2024, there have been about 34,000 deaths related to COVID-19, and a number of hospitalizations. Now, deaths and hospitalizations tend to be among what we call high-risk individuals. So those are people who are 65 and older. Those are people especially who have underlying health conditions, especially those 65 and older with underlying health conditions like maybe obesity, diabetes. If they have a heart condition or a lung condition, it puts them at a higher risk for having serious illness and potentially death. So the CDC recommendation for COVID-19 is that anyone 65 and older gets it, but obviously all of us can. I look at it as what can I do to protect myself and those high risk around me. My parents are both over 65, and I see them very regularly. I don't want to potentially, COVID's probably not going to be an issue for me, but if I have it and spread it to them, it could be a major issue for them. So that's why I look at getting vaccinated. So again, almost everyone can get the COVID vaccine, but definitely if you're 65 and older, or you have one of those underlying health conditions, it's really important to get vaccinated, because even though it's not 100% effective at preventing illness, it can help prevent serious illness. And actually, research has shown that it is about 54 people who are vaccinated, about 54% more protected against getting ill and hospitalization from COVID.
Those are some strong numbers. All right, there are those out there who will say, well, the doctors are now saying we should take the flu vaccine and the COVID vaccine at the same time, and they don't like that idea. Why is it a good idea?
Well, you never know when you're going to be exposed to either flu or COVID. It could be any time during your day, and they've been shown to be effective when administered at the same time. So, the earlier we can be exposed to it through the vaccine, the earlier you can start producing those antibodies and other protective factors to maybe prevent illness. So again, this is the time when we're looking at, September, October, August, September, October, is the time we start to see an increase in, especially flu. So, we want to make sure you get vaccinated to prevent that.
Okay, now you mentioned another one before we started taping, and that was RSV.
Yeah, absolutely. So RSV, or respiratory, I can't pronounce it, but so I refer to it as RSV.
I won't try.
Yeah, it's usually a mild illness. It has cold-like symptoms. However, in our youngest, newborns, very young children, and elderly, it can cause more serious illness. In fact, there are about 100 to 160,000 adults 60 and older hospitalized for RSV each year. And some risk factors for severe illness related to RSV are being 75 and older, having, again, those underlying conditions that make all of these illnesses more dangerous: obesity, heart disease, lung disease, diabetes. They all put you at increased risk that if you contract one of these, you're more likely to have a more serious outcome or death. But again, in some cases, anyone could die from it. So RSV right now is suggested for individuals 60 plus, but CDC, so if you're 60 and older, you can get the RSV vaccine.
Okay.
However, CDC recommends everyone 75 and older get it, or those 60 through 74 who have those underlying health conditions. Okay. And you can work with your healthcare provider or the pharmacy to do that. But RSV right now is only a single dose. And again, it was approved in, I believe it was 2023. So it's single dose right now. We'll continue to collect data to see if it provides lifelong immunity like some of our other vaccines, or if a booster is eventually needed. But right now, if you are 60 and older and have those underlying health conditions, or you're 75 or older at all, it's recommended you get that RSV vaccine. Mm-hmm.
Now, there's some others that, I'm not positive if there are vaccines associated with them or not. You mentioned shingles.
Mm-hmm. Yep, so shingles is an illness that is caused by the same virus that causes chickenpox. So once you have chickenpox as a child, the virus lays dormant in your nervous system. And as you get older, or your immune system is weakened, either through medications, other illness, or like just age, it can reemerge as painful blisters, and we call that shingles. So they're very painful. They can lead to like hearing and vision problems depending on where you get them. You can get them anywhere on your body. A lot of times we see it on like the trunk, but again, it can be on the face. It can impact your eye, your ear, cause neurological problems. But the main thing is it's a very painful illness. So great news for anyone who is young enough to have gotten the chickenpox vaccine. They're already less likely to get shingles as they get older. But for any of us, like myself, who had chickenpox as a child, my risk continues to increase as I get older. And the shingles vaccine is one of the best ways to prevent developing shingles. So it's a 2-dose series. You get it 2 doses, and then you're good for life again. So that's, again, not a seasonal vaccine. You just get 2 doses, and then you're done.
Is that one all right to get with the other 2 major ones?
Most are, but definitely that's one that you might want to talk to your healthcare provider or the pharmacist just to verify. and it might just be they put them in different arms. With the shingles vaccine, it's, I believe, a live one, and it can cause like a small rash that you have to keep covered. So there's just some care that's a little different for that one.
Gotcha. HCV.
HPV?
HPV.
Yep. So I'm glad you asked about that one. So the HPV prevents human papillomavirus, and it is the only, a lot of people associate it, well, because it is, HPV also causes genital warts. So typically genital warts are spread through sexual contact. And people think of it as a vaccine for preventing an STD, but really what it is it is an anti-cancer vaccine, and it's really our only anti-cancer vaccine. People who become infected with HPV are at a higher risk for developing, especially women, cervical cancer. However, for men and women, it can cause oral cancer, throat cancer. It can also cause anal cancer. So there's a lot of cancers that HPV can cause, the human papillomavirus, and by getting vaccinated, it protects you from the strains that are most likely to cause those cancers.
Most often given when the person is younger?
Yes, so it's only going to be effective if it's given prior to coming in contact with, those viruses that cause HPV. So ideally, it's best for a person to receive it before sexual contact. Because again, once you've been exposed and if you contract HPV, you're already more at risk now for cancer. Right. So we want people to get it when they're younger. However, certain age groups, I think it's approved, I'm not going to say a specific age because I'll probably get it wrong, but it is approved for older ages now because again, just anything that can help prevent cancer, we want people to get. So whether or not you've been sexually active, if you haven't gotten HPV, talk to your doctor. If you are a parent or a grandparent or something like that, talk to a provider, talk with other parents. Like I said, there's just a lot of stigma from it because again, HPV is sexually transmitted, but it's really important to think about this is actually going to potentially prevent your child from having cancer when they're 40, when they're 50, later in life, and that's why it's important to get it.
Right. Okay, let's go back to COVID for a moment. Does the Whiteside County Health Department prefer one brand over another?
No, absolutely not. The best vaccine is the one you get. So both Pfizer and Moderna are the typical ones we see here in the U.S. They've both been approved for the 2023-2024 year. So, whichever one is available, whichever one you're the most comfortable getting. Some people have like a vaccine loyalty, and I'll admit, I kind of do too. The first one I got is the one I prefer to continue with, but again, it does not matter. It's been shown to be effective. Both have been shown to be effective, and they've both been shown to be effective if you've received one and then later received the other.
All right. Anything else the Whiteside County Health Department would like to get out there to the public? I know people have a lot of questions about health, as they should, and about diseases that spread also, as they should.
Yeah, absolutely. I mean, there are a lot of things people can do to stay healthy. We all know some of them: exercise, eating healthy, things like that. Think of vaccinations as another tool to help you stay healthy. But as I mentioned, all of these, most of these illnesses tend to cause more severe illness in people who have underlying health conditions. So that's why it's important to get checked out. Go to your provider regularly. They can work with you to make sure that if you do have a condition, some people might not even realize they have a heart condition or diabetes or something like that. So it's important to get that preventative care as well. So again, unfortunately, there's not just one thing we can do to stay healthy, otherwise we'd all do it. It's a lot of little things, but work with your provider, get vaccinated. Those are the main things.
All right. We've been talking with Cory Law from the Whiteside County Health Department. Thanks for coming up.
Thank you for having me.
And that's this edition of Along the Rock. I'm Mark Morris, and we'll have another one coming up before too long as well, so I hope you can tune in then. Until that time, see you later.